Good morning. My name's Katie Thompson. I'm a registered nurse and international board certified lactation consultant. I'm going to talk to you today about the one thing that I would do to improve today's healthcare system. But before I do that, I want to give you a little background on how I arrived at the decision that I did. Back in 2011, the U.S. Surgeon General issued a report that was a call to action to the United States to support breastfeeding and breastfeeding women. This report was based on extensive research that shows that if women will breastfeed, they significantly decrease their chances and their infants' chances of diseases. Some of these are respiratory tract infection in infants, gastrointestinal tract infections, childhood obesity, diabetes, some childhood leukemias, and even sudden infant death syndrome. Women who breastfeed are also at a much risk for ovarian cancer, breast cancer, and osteoporosis. The report the Surgeon General issued went on to say that if 90% of women in this country would exclusively breastfeed for 6 months, and that's the suggestion too of the American Academy of Pediatrics, that we would see approximately a $1.6 billion decrease in healthcare cost, and that over 800 lives could be saved. The Surgeon General's report went on to discuss in detail 12 different actions that this country, healthcare facilities, our communities could take to support breastfeeding in women. What I would recommend that we do, my one fix for our healthcare system would be to take these suggestions that the Surgeon General made in this 2011 report and roll them into the Affordable Care Act. Prioritize them, make them law, and phase them in as part of the law. Now, don't get me wrong, I'm not advocating that every woman should be required to breastfeed by law. I'm just saying that every woman should be given the information that she needs and the support that she needs to make a good informed decision, and that she has the support to be successful at breastfeeding. Obviously, if we implement these changes, and it would be over the course of a period of time, we would go back, we would look at our country's breastfeeding data, we would look at the incidence of these diseases, and we would hope that we would see an improvement. Now I'm going to talk a little bit about where I believe we're headed in this country with health care. I don't think there's much doubt that we are headed toward universal health care. Many international organizations, including the World Health Organization, the United Nations, have encouraged countries to move toward universal health care. And really, the U.S. stands out there alone with industrialized nations in the implementation of universal health care. Now, we've come a long way with the Affordable Care Act, and so we're headed in that direction. And I believe as we move forward with it, we're going to see some of the same things we've already seen. We're going to see nurses more involved in tracking indicators that really force us to do the right things. We're going to see more people with access to health care. I think the best nursing care model for this kind of a healthcare system is going to be an interprofessional nursing care model that encourages teams of nurses to work together to be able to implement complete and total patient care. As far as what I think we need to do to get ready for that, hospitals need to be talking to universities, the government needs to be involved to ensure that we have the proper amount of nurses to support the increased number of people that we're going to be seeing in our facilities. What our facilities need to be doing also is training their nurses to be much more cross-functional so that work can be moved around as the demands are there. But there is no doubt in my mind that this is the direction we're headed, irregardless of the presidential election that's upcoming.